Hi, my name's Phil. I like talking about politics, and in this video, I'd like to discuss how the government's NHS week is going as they have to confirm that Health Secretary Stephen Barclay lied about doctors in an interview a few days ago, and it's revealed that a former close advisor advocates the complete removal of the NHS. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel. So a few days ago, the Health Secretary Steve Barclay, who has been largely absent from the public eye. I've noticed you've not really seen much of him. I was told apparently he's been trying to shore up support for his own seat in his local constituency, instead of doing any work for the government, like negotiating with doctors. Apparently he's going to have problems with his own seat. So he tried to kick off the Tories' NHS week with a false claim about doctors. When it has come to public sector strikes, the Tories and their client media have consistently tried the tactic of trying to claim that the workers involved are actually paid much more than they really are. So, for example, they conflated the higher paid train drivers with rail workers. So when the RMT go on strike, train drivers are paid a fortune. Yeah, that's not train drivers, mate. They tried to claim that the average teacher somehow earns more than the top of the entire pay scale, with a similar trick employed for nurses. All of it is designed to drain away public support by claiming that actually they've got more generous incomes than they really have, even after 15 years of real terms pay cuts. So in this same vein, Barclay claimed that when consultants retire at 65, they get a tax-free pension of £73,000 a year. Problem with this statement? It's not remotely true. In fact, so untrue is it that it could not simply have been something that Barclay misunderstood and inadvertently said to be untrue. He must have told a deliberate lie, because it's such a baffling thing to say. For the avoidance of doubt, doctors' pensions are treated in exactly the same way as everyone else's. And what's more, his own government department, the Department for Health and Social Care, confirmed this when asked by journalists. So it looks like the NHS week is going about as well as asylum week went for the Tories then. The government have already had to confirm that the Health Secretary is lying to the public. They've just announced today that they're lowering the bar on cancer targets rather than actually work to meet those targets. And now we find, though not surprised to find, that a former close advisor to Steve Barclay advocates the complete destruction of the NHS. The New Statesman was reporting that a close aide of Barclay's from before his time as Health Secretary has said that politicians should have the guts to rip the NHS up and start again. Well, start again, does that mean, doing it from scratch and properly nationalising it? No. He's quite clear about what he means. Full privatisation, he said. Oh, yeah, sure, because privatisation's been working a treat, hasn't it? Whether the existing and increasing privatisation of the NHS or other public services. I challenge any of these people to tell me a single privatised service in this country that is either working better than when it was nationalised or is cheaper. Because that's what they claim, isn't it? Privatisation means a better service and for less, because the competition drives down the prices and up the standards. Only it's crap. We pay more in real terms than we did under the old nationalisation model for all of these services. And the service is pants. It's not even that the service is bad in some areas and good in others, so maybe the bad ones need to learn lessons from the good. There are no good privatised public services. Prove me wrong. None at all. The trains, nightmare. Buses, non-existent. A recent study found that we have only half the bus services that we did in 2010. Energy is incredibly expensive. Water is also expensive and polluting our green and pleasant land. The only green that our water companies are promoting is algal blooms in lakes. Royal Mail has gone downhill since privatisation. Telecommunications, a complete joke. Internet is incredibly poor quality in this country compared to similar economies, and mobile phone coverage is sketchy at best if you don't live in a city. And it's all way more expensive than countries who have got much better quality service. We've also seen worse outcomes in the NHS since privatisation, taking it back to NHS week. Take this latest news that the government are binning their cancer targets. Now, why might that be? Would it be because Matt Hancock privatised cancer services a few years ago when he was Health Secretary? Do we think that might be the reason why they're now missing their targets? That Steve Barclay is saying that this aide's views do not reflect his own might be worth something ordinarily. Of course, just because you have an advisor who has a view on something doesn't mean it's your view. But we might believe it more if his actions at Health Secretary weren't exactly in line with this thinking anyway. But we can see more and more privatisation of the NHS. NHS budgets are now allocated by owners of private healthcare companies. So even the money that goes to the NHS rather than straight to private providers is still diverted to private providers, because those providers sit on the NHS committees who decide how to spend the money. Like, how is a private healthcare provider going to decide how to spend NHS money? More investment or subcontracting out to their company? But even if we put all that to one side, I'm still not sure we should believe that Steve Barclay is telling the truth about, not being a fan of full privatisation. That's what he's trying to claim now, given that he decided to kickstart his NHS week with an easily provable lie about doctors. And if there's one thing we really don't want any health secretary to do, it is to be seen as a bad faith actor in the eyes of medical professionals when we have such severe shortages of them in the NHS. But there we are. Those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, please click the like button. And if you'd like to support the channel further, the join button for memberships. And until next time, I'll see you later.